Peter, you're a surgeon, an academic, and an entrepreneur. How did it happen?
I guess my problem, as some people would say, is that I'm really curious about things. I've always been really curious about things. And in fact, turning into a surgeon, I might have been a general practitioner, cardiologist. Whatever I did, I really enjoyed. But since being in surgery and understanding better the problems that people face and being introduced in the ecosystem of the university, I guess the ability to ask and answer those questions became more reachable for me. And that allowed me to then develop the research programs behind what we do and ultimately translate. I was always interested in translating, taking a discovery and how will it work in real life. And the sort of discoveries I'm talking about are just, let's call it healthcare improvements. How can I improve what I do as a surgeon, as a doctor, so that the patient has a better outcome? So for a greater part of my research, my academic life, I've studied how what I do brings an outcome and how can I improve that outcome going forward. Later on, as I guess part of my research horizon broadened, I was more influenced by technology and devices. And then one started to think, well, gee, if I had that particular device, imagine what I could do better. So my interaction with my colleagues, with patients, with industry, with research teams allowed me to really put the jigsaw together and say, well, actually, translation is more than just doing a better job. It can allow me to be creative to help me do it better. Failure and the grant system. People tell you today, success at NHMRC is 10%, 15% only. But every year we come back with a better grant and we try, and then one day it works. And that's a little bit about like startups. The world of grant applications in some ways prepared me a little bit for startup worlds and things of it takes a number of iterations before you get to where you want to go, and you run the gauntlet of failures. You have to learn to be resilient if you want to be in the world of research. Our grants, our papers, our presentations, question and answers from the podium. We have to be resilient. That comes from really understanding your product, believing in the direction and the reasons for why you're doing it. I'm just wired in a strange sort of way. I can be in any conversation anywhere. When I hear someone saying, gee, I have a problem about this or that, straight away my brain starts thinking about it, whether I like it or not. And I find myself getting really involved in conversations, oftentimes in areas that I know nothing about, but I enjoy asking the question. My peer group is a network of people that spans every different type of researcher, clinician, and the more the merrier, the more variable, the more wonderful the color. And so I am blessed by people who have been prepared to work with me and discuss with me and solve problems. The most important thing I think about innovation is that it is iterative. There's try, succeed, try more, fail, try something different, succeed, grow and build. It is not about planning everything to the nth degree, years on end, optimizing and then executing, because that period of expected success and perfection has not been found to be necessarily value adding. I would love to see a community of intellectuals who are not afraid of failure, who run towards things like that. And as I said before, it's daunting, the skin in the game. I want part of that. But this is important because we're solving problems of health and life sciences. But this is thrilling at the same time because it's making me perform at the best. And that's the sort of community I want to do by injecting, I guess, the spirit of innovation enterprise. And it comes with doing different things. Educational programs, funding grant programs, support programs, linkages with other universities and collaboration. And the normality of collaboration is what drives innovation. The days of the single applicant NHMRC well and truly over. We run boot camps to help them. We run educational programs. We link up with the TRAM, for example, with Innovation by Design IBD programs. We interact very closely with RIC and the Melbourne Economic Centre, our Entrepreneurial Centre, to try and link people with with other people who are translating all the time. We have developed grants in aid, the innovation grants, but we also have the innovation awards, which is our prize position where we take people and we say, you have 2 years to do that really important part, perhaps the final part, the regulatory part, the final conversion of your minimum viable product, that part, and take it to fruition. We want to fund those people. There won't be many of them, that's why it's prestigious. And we hope that the different schools can look at ways that they can champion their people to get these, because they are the start of, they're the front line, and hopefully they will show people that normal folk can achieve great things. Innovation is about how you do things better. Good result, better result, faster result, more efficient result, cheaper result. It's how you do things better. Researchers are the original entrepreneurs. They have had this idea. Don't ask me why, but I read something somewhere and I feel passionate about this. And then they spend 3 years, 4 years doing their PhD, then they do their postdoc and they chase it down. They are the original entrepreneurs. And what we need to do is fire that spirit, support that spirit, and not all of them will want to go to a startup, but they may be happy enough to generate the information that feeds a startup. You have people who find something, discover something, and they do a startup, and the first question that is asked is, are you prepared to be a CEO? I was asked that question myself. You know, you've got this great product, stop arthritis, will you be the CEO of the company? Would I actually be the right person to run a company? Right? I think about the target, I think about the delivery, I think about the applicability. That's my specialty. We should get specialists who run companies, who understand the bio world, perhaps, but they are much better at running the company, marketing, support, human resource, so on and so forth. Possibly because we haven't reached that point in our own maturity, because, you know, INE, Innovation Enterprise, University of Melbourne, is grabbing hold of it and has the power to really accelerate it, but we are still at an early stage. The point that they enter is the point of maximum passion, because people make decisions based on passion. The good thing is, it's not just me. I am part of a larger team. We are also now on the website of the faculty, so you can click and find out who we are and what we do. The reality is, we're not busy, we just have lots to do. And I think the thing is, just because we've got lots to do shouldn't stop people from reaching out, because we connect up. Make use of it. It's there to be used. Find out when the next round of grants are. What does it take to win a grant in that area? What are we looking for? Because we're just trying to look at the grants and the activity through the lens of people who will ultimately fund it.
Thanks so much, Peter. Maybe your last sentence, the one line you would give away is the most treasured advice to any ECR listening. What would that be?
Be brave. It's okay to fail.